China fully opened its borders this weekend for the first time since the start of the pandemic. Travelers are now allowed to enter the mainland without spending time in a mandatory quarantine.
The easing of travel restrictions comes as China is struggling with a major COVID outbreak. Hospitals across the country are running out of beds. The CDC now requires travelers from China to show a negative COVID test before entering the U.S.
Dake Kang is here with us in Studio 57 to talk more about this. He's a China correspondent for the Associated Press. Dake, thanks for being here. So one of the big concerns about the COVID situation in China is the sense that there is a lack of transparency, that China is not sharing all the information about the outbreak there. What can you tell us about that?
Sure. There's many aspects to this. From the beginning of the outbreak, a few years ago in Wuhan, China was not consistently giving timely updates on the outbreak itself, on the nature of the disease and the outbreak's spread and severity. And so, I think these concerns are kind of playing out right now. We just don't know how many people are getting infected, how many deaths there are, how many serious illnesses there are. And that's, obviously a concern because we don't know exactly what the situation is that we're dealing with. The other aspect to this is, of course, whether there's a possibility of a new variant that could emerge in China. China has an enormous population that has not been infected with the virus yet. And, when the virus goes and spreads in a large population, that's obviously a possibility. So I think medical authorities across the world are really concerned about the possibility that could emerge.
So, Dake, to follow up on that, are Chinese authorities expressing any concern about the potential for increased spread and those new variants?
Yes, I think, Chinese authorities have said that they are going to be tracking the virus and any potential mutations. They announced that they're going to be setting up these systems and in response to concerns from countries across the world and the World Health Organization. They have also said that they are going to be uploading genomic sequences. However, the number of genomic sequences that they've been uploading relative to other countries has been relatively small.
Yeah. Well, tell us what percentage of mainland China residents are vaccinated, and is there a government effort to try and get those numbers up? We know that there's some difference between the effectiveness of the vaccines that are offered in China and those that we're using here in the United States. But just at the base level, are enough Chinese people vaccinated to help mitigate the spread of new variants, et cetera?
So the main difference between the Chinese vaccines and the ones that we're using in the U.S. and other countries is that the Chinese vaccine really requires at least 3 shots. And so, if you look at the number of people who are getting vaccinated, they have all these statistics saying, over 90% have been vaccinated and so on and so forth. But the really critical thing is seeing how many people have been vaccinated with 3 shots, and specifically the elderly population, because they're the most vulnerable to, hospitalization and potentially death. And there, the numbers are a lot more concerning. There's tens of millions of people, at least, elderly people vulnerable to this disease who have not been fully vaccinated with the 3 shots necessary. And there has been a vaccination campaign. I think the government realizes that this is a problem, and they've been really trying to bolster that vaccination rate. But, to be honest, it's really difficult because this policy change was so sudden that a lot of people didn't really have time to prepare.
From the zero COVID policy.
Exactly,
right.
Exactly. So a lot of people didn't realize this was coming. They didn't necessarily feel like they had time to prepare. And, frankly, people are scared of going to get vaccinated now because they worry that they might get infected with COVID if they go and get injected right now.
Which we know is not actually the case. But
right.
Yeah.
You know what? I wonder, Dake, we remember those images on social media not that long ago of unrest among Chinese citizens, right, who were upset over the way that the government had imposed these lockdowns and continued lockdowns. I would imagine that that is a factor, of course, in how Beijing decides to move forward here. Is there any kind of sense that as they go ahead and try to pivot to different kinds of postures when it comes to COVID, that unrest remains just under the surface?
Yeah, I think that, in the past, this is a big picture kind of thing. In the past 10 years, under Chinese President Xi Jinping's rule, China has really cracked down on freedom of expression and freedom of speech. And, as a result, you don't necessarily know how people are feeling about various policies. And I think that these protests was a manifestation of that. I mean, there was a lot of discontent kind of building over the course of, the last year over zero COVID. But I don't think the authorities were necessarily fully aware of the depths of that discontent. Obviously now, there's a policy shift, things are opening up. A lot of people are happy with the policy.
Sure.
I mean, they're just excited that they'll be able to
go,
go
back
exactly,
and
go outside and travel again. But
right,
there's
remember
also
how difficult it was for all of us. But
yeah,
right.
it was very difficult. But obviously, there's some people who are going to be very upset with the fact that they feel like they weren't given enough time to prepare for the onset of COVID, and so there's always going to be discontent. Whether that's something people can express, that's another matter altogether.
All right. Well, Dake Kang, thank you so much for
Thank
talking
you.
to us. We appreciate it.
Thank you. Thank you very much for having me.